Hi, welcome to our telehealth video information series. My name is Garvin and this video is on Lotriderm. So what is Lotriderm used for? It's used for fungal skin infections such as athlete's foot, ringworm, candida skin infections and sweat rash. So how does Lotriderm Cream work? Lotriderm Cream contains clotrimazole and betamethasone dipropionate. Clotrimazole is an antifungal medicine that kills fungi and yeasts by interfering with their cell membranes. It works by stopping the fungi from producing a substance called ergosterol, which is an essential component of fungal cell membranes. The disruption in production of ergosterol causes holes to appear in the fungal cell membrane. This kills the fungi and treats the infection. Betamethasone is a potent corticosteroid. It reduces skin inflammation by stopping skin cells from producing various inflammation-causing chemicals that are normally released when the skin reacts to irritation. These inflammation-causing chemicals include prostaglandins and various other inflammatory substances. So they cause blood vessels to widen and other inflammatory substances to arrive, resulting in the affected area of skin becoming red, swollen and itchy. By preventing these inflammatory chemicals from being released in the skin, betamethasone reduces inflammation and relieves the related symptoms such as redness and itchiness. So how do you use Lotriderm Cream? Lotriderm Cream should be applied thinly and evenly to the affected areas of skin twice a day, so 12 hours apart. Wash your hands after applying the cream, unless the hands are the area being treated. The cream should be used for 2 weeks to treat ringworm or candida infections and for 4 weeks to treat athlete's foot. Make sure you keep using the cream for the length of time prescribed by your doctor. If you stop using it too early because the symptoms have cleared up, the infection may come back. If you are using the Lotriderm Cream to treat athlete's foot, you should make sure you wash and dry the feet, especially between the toes, before applying the cream. You may also want to use an antifungal powder inside the socks and shoes to help treat the infection and prevent it from coming back. Do not cover the area being treated with airtight dressings, such as bandages or other dressings, as these will enhance the absorption of the medicine into the body and may increase the risk of side effects from the steroids. If your skin seems to be getting more irritated or an infection has not cleared up after the course of treatment is finished, you should consult your doctor. Lotriderm should be used with caution in children. Lotriderm Cream is not licensed for children under 12 years of age. Also use in caution in psoriasis. If you have been prescribed this medicine to treat areas of skin affected by psoriasis, you should have regular checkups with your doctor. This is because although corticosteroids may be useful for psoriasis, in the short term they can sometimes make psoriasis worse and may cause the condition to relapse into generalized pustular psoriasis after the treatment is stopped. Who should not use Lotriderm? You should not use Lotriderm Cream on areas of skin affected by viral skin infections such as chickenpox and warts or verrucas, and bacterial skin infections such as impetigo, and also for acne, not to be used, and chronic inflammatory disorder of the facial skin, acne rosacea, and inflammatory rash around the mouth, nappy rash, also not to be used in. So can you use Lotriderm Cream while pregnant or breastfeeding? This medicine should not be used during pregnancy or breastfeeding unless considered essential by your doctor. If it is prescribed by your doctor, it should not be used on large areas of skin underneath airtight dressings or for prolonged periods of time. So what are the possible side effects? They are skin irritation, so redness, rash, itching, stinging or burning, or allergic inflammation of the skin. And stop using the medicine and consult your doctor if you think you've experienced a reaction or your skin condition appears to be getting worse. Secondary infections, so reduced skin pigmentation and stretch marks would be other side effects, and thinning of the skin, inflammation of the hair follicles and excessive hair growth would be more side effects. And prolonged use of this medicine on extensive areas of skin, broken or raw skin, skin folds or underneath airtight dressings may on rare occasions result in enough corticosteroid being absorbed to have side effects on other parts of the body. For example, a decrease in the production of natural hormones by the adrenal glands or symptoms of Cushing's syndrome. So can you use Lotriderm with other medicines? This medicine is not known to affect other medicines. If you're using other topical medicines on the same area of skin, it is recommended that you leave at least 30 minutes between applying each product. This is to allow each product time to be absorbed and avoid the mixing on the skin. If you apply moisturizers shortly before or after applying this medicine, these can dilute the medicine and potentially make it less effective. So try to apply the moisturizers at a different time of day or at least 30 minutes before or after this medicine. So that brings this telehealth video to an end. If you have any questions, you can leave them in the comments below or contact me through our website, mytelehealth.info, or call into us at Lynch's Pharmacy in Douglas and Cork. You can ring us on 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.